So urology conditions that we see, ranges from general urology, and these are things like urinary difficulties, enlarged prostate, urinary tract infections, blood in the urine, kidney stones, to sometimes much more sophisticated issues, urinary incontinence, erectile dysfunction. We talked a little bit about prostate cancer, kidney cancer, both of which are probably our two most common cancers that we see. Bladder cancer is a particularly lethal one, very highly linked to smoking, and that's a big problem in our society, as you know. And that is something that can affect both men and women. And so this is one of our most lethal cancers, and probably one of our strengths in our department here is treating patients that have bladder cancer, because this requires multidisciplinary care, but also lifelong follow-up to monitor for recurrence of cancer. But there are also pediatric conditions. So we treat congenital abnormalities, infertility abnormalities, and again, female urology conditions as well. So as a tertiary medical center, a lot of patients come to us because they have conditions that a local or community-based physician feels is too complex for them to be treated locally. And so oftentimes they come to see us for second or third opinions about a variety of different maladies. And so they come to our urology clinic or roomed by our nurses. Vital signs are taken. There's a period of time, anywhere between 30 minutes to sometimes an hour, that we'll spend taking a history on what's been going on, reviewing their series of documents or tests that they may have had prior to their visit, doing a physical examination, coming up with a treatment plan, some of which entail surgery, some of which may entail further testing. We are a field that is very intensively reliant upon imaging. That can be ultrasound, CAT scans, MRIs, PET scans. So oftentimes these are tests that are necessary to further define the particular problem at hand, and there may be follow-up visits where we go over those tests and come up with a treatment plan. We're also involved in a lot of multidisciplinary care, and that's involving other disciplines of medicine, whether it be radiation oncology, medical oncology, pathology, radiology. And so we're constantly integrating with these other teams to try to problem solve to say what is the best case treatment for this particularly unique individual. So this is a very common theme called multidisciplinary patient-centered care. So I'll answer then two questions. First, as a urologic surgeon, it is a surgical subspecialty. We treat a lot of disorders, as I mentioned, and these can be surgeries ranging from very large invasive surgeries, and this is open surgery or conventional surgery, to laparoscopic surgery, to robotic surgery, and to microsurgery. So speaking again of the diversity of what urology is, the toolbox, if you will, of what a surgeon gets to do is very, very broad. And that, I think, is one thing that's very exciting about being a urologic surgeon, is not being pigeonholed to do only one type of surgery, but a large variety or a wide array of surgical treatments. A lot of the disorders that we treat range from cancer to kidney stone disease to urinary incontinence, sexual dysfunction, and then a lot of pediatric conditions, female urologic conditions, reconstructive urology is another area, trauma, and so forth, so on. So there's, again, a lot of different types of disorders within the urologic system that we get involved with.